Okay, so in terms of self efficacy, COVID 19 mitigation behaviors are fairly minimal. They're usually viewed as a minor inconvenience rather than a huge commitment. The behavior could be easily achieved if the motivation was possible. So, doing simple things such as like keeping away from other people, wearing a mask, washing your hands, they're all fairly simple actions. But it's finding a way to motivate young people to take those actions, which leads to cues to actions, which is something that I refer to as a educational epiphany. If there's like, I believe that there's just like, if you're able to educate them enough, you'll like they will reach this sudden realization that wearing a mask or performing these behaviors are very beneficial to not only themselves but the public as a whole. So that's what I mean when I refer to a educational epiphany. And actions such as easier access to mask and cleaning stations would also get them motivated to begin engaging in COVID-19 mitigation behavior. So in terms of the theories of planned behavior, that's my second theory. I'll follow three constructs. The first one is attitude towards the behavior. Young adults believe that the actions can be potentially positive, but like I said before, they view engaging in these behaviors to be inconvenient due to the fact that it seems like they have little to gain from it and little consequences to suffer from if they weren't to engage in that behavior. While older individuals may be more prone to engaging in this behavior because this disease is something that would affect them more. There's also the subjective norm. The environment in which the individual grew up around may influence their beliefs when it comes to engaging in COVID 19 mitigation behavior. So, in Illinois, individuals may be more prone to wearing masks, or they may be more willing to wear masks versus individuals in Texas, for example, who may have the same mindset that I've explained earlier. And it's perceived the last construct is perceived behavioral control. Young adults believe that these behaviors are easily accomplished, like I said before, but also, like I said before, it's inconvenient. Staying away from people, wearing masks, washing your hands, they're all like easily accomplished actions, but it's that young adults, I'm pretty sure, are confident that they could do it if they really wanted to, but it's actually getting them motivated to, which is the problem. I've had many friends who've said that if they get it, they get it. They'll more than likely recover from it anyway. Something that I refer to as pandemic fatigue, like all these measures to prevent them, and nothing seems to be improving. They just get tired of having to engage in all these behaviors that they just decide like whatever. So the intervention methods that I've came up with was increased education so you can accomplish education epiphany. Provide young adults with as much information as possible, or that one vital piece of information, or vital pieces of information, such as engaging in these behaviors, specifically wearing masks, which seems to be the main one, will not only does it help you out, it helps the other person out who may be more prone to it even more so, especially in the case of wearing masks. You like when you're asymptomatic, you don't know whether you have disease, but you're still able to spread it around.